Can you give us some examples of the types of complex orthopedic injuries that you see in everyday practice?
Majority of the patients who would require limb reconstruction are usually patients who sustain their injuries either a road traffic accident, motorcyclists in particular. Usually we see that the majority of them will have a high energy trauma. So this will be a high speed or fall from a significant height, or there will be any heavy machinery involved, which would then to damage their limbs. We would regularly treat also motorcyclists. They are quite exposed on their motorbikes, and usually lower legs get significantly injured. As a standard, they will incur soft tissue loss and then also bone fractures. When the limb is salvaged, patients will have their own limb. They won't have anything they need to attach or detach whenever they go to bed or different reasons. We also see that people with amputation, whilst it sounds quite tempting and a very simple solution, they have significant downtime. They cannot use their prosthetic limb because of the problems with the stump or problems with the prosthesis, ulceration, or any other problems. We see that on average for an amputation, for stump to mature, people need 9 to 12 months. And on average, for an average limb reconstruction, we also need 9 to 12 months. Then if you look at the functional outcome, you will find out that in the literature, the results are more or less the same with people, comparing people with an amputation and people with limb reconstruction.
We certainly have experience of clients who have crush injuries, particularly foot injuries seem to be the real problematic area, where they have prolonged treatment for sometimes years and there is no function. There's not just the orthopedic pain, but obviously nerve pain as well. And, you know, I think it's an entirely subjective decision, isn't it, based on age and activity, as to whether or not you continue to go down trying to salvage the limb or not.
Yes, exactly. So salvaging limb decision is multifactorial. So whether the limb is salvageable is the first question, and what is the expected function after the job is done. And if we can answer all these questions positively, then we should decide. But the final decision is certainly with the patient. We just had recently a young boy who sustained a significant crush injury to his foot. And there is no doubt that we were able to reconstruct the soft tissue, heal the wounds, and also heal the fractures he had on his foot. We estimated and expected that the function of his foot will be really poor, and he won't really have any good limb to lean on for the rest of his life. So we recommended him an amputation, and I strongly believe that he made a good decision and agreed with it.
At what point with a limb salvage patient do clinicians tend to advise or recommend amputation? In what sort of circumstances have you reached the end of the road?
We tend to offer amputation more or less from the beginning, as we see that the longer we wait and the longer we delay an amputation, the worse outcome people will have probably, and also the more psychological impact they will have as a result.
And do you sometimes find that patients want as much to be done as possible in terms of trying to save their limb, and that they almost need to go through a process themselves of thinking, this is as far as we can go now. The only other option for me now is either to live with what I have or to go down the elective amputation route. Sometimes you have to take that into consideration if you're holding off on performing an amputation?
Yes, and this question is particularly important if we delay the amputation for any reason. I see in my practice that if the amputation is delayed, then people struggle significantly more to make the decision, because I just had a patient recently who said, I will always have in my mind, what if my leg could have been saved and now I had it amputated? Even the fact that he had multiple problems on his leg, starting from his foot, ankle, and knee problems, which were all causing a lot of problems to him, he still felt that maybe there is a cure for my problems.